We are here today to talk about CBHAs, HLOC MDTs, therapeutic placements, and suitability assessment referrals. We're going to start with CBHAs, also known as comprehensive behavioral health assessments. When children are sheltered by the Department of Children and Families and not placed with a parent, they are required to have a CBHA completed. The CPI will complete the referral and send it over to SPOC. The BHC or someone from the clinical team will then take care of the referral from there. You should expect a completed assessment within about 20 days. A child is eligible for an updated CBHA once every fiscal year, which starts on July 1st, and a child only needs to have Medicaid in order to qualify. A CBHA will give you a summary of the child's life prior to coming into care and the life of their families. We currently have two providers that we utilize, Tampa Bay and Camelot. The BHC or someone from the clinical team will decide who is going to complete your assessment and let you know. Higher level of care staffings. Anytime in need of a higher level of care, the clinical team will conduct a staffing. We will discuss clinical information, case updates, and treatment progress. We will determine eligibility for specialized therapeutic placements and make a recommendation. Core members of the staffing include the staffing coordinator, the family care counselor, the child's parents, the clinical professional, and anybody else that is assigned to the case, like AAL or GAL. However, in order for the staffing to take place, the clinical staffing coordinator, the family care counselor, must be present. In order to request a higher level of care staffing, you must simply reach out to the clinical department and let them know that you are in need. We will ask some follow-up questions to make sure it qualifies and take it from there. In order to have a competent staffing, we must have everybody in attendance and full participation from all of our parties. When participating, it is expected that the FCC and the therapist, if on the staffing, is completely knowledgeable of what is going on in the day-to-day life of the child. We'll talk about treatment planning, discharge planning, and then make a recommendation for the child. If a child is going to go into STFC, otherwise known as Specialized Therapeutic Foster Care, we will hold a staffing typically on a Monday. During the staffing, we will review how the child is doing or what is leading the child to go into such a placement, and then make a recommendation for the team. Therapeutic placement. There are a number of different therapeutic placements available for children. The first and lowest level is Specialized Therapeutic Foster Care, also known as STFC. The second is Specialized Therapeutic Group Home, also known as STGH or QRTP. Specialized Therapeutic Behavioral Therapeutic Group Home is a BQRTP. A statewide inpatient psychiatric program is a SIP or PRTC. And then there's a substance abuse residential treatment facility, which is a SUD. A high level of care staffings for each child happen every 30 to 90 days depending on their funding requirements. The level of care will be dependent on the team's recommendation and possible assessments completed on the child. So what exactly is a specialized therapeutic foster care has two levels, a level 1 and a level 2. Level 1s are least intensive and level 2s are the highest. Level 2 children have in-home therapy twice a week and psychiatric services once a month. Level 1 requires minimum of weekly therapy and psychiatric visits once a quarter. H or QRTP is a non-locked group home where children can receive intensive services. A BQRTP is similar to the QRTP, but for children experiencing behavioral therapeutic concerns. A PRTC is a psychiatric residential treatment center. This is our highest level of care. It is a locked facility where children are not allowed to leave campus without an adult. They have inpatient therapy, psychiatric care, and emergency ETOs if needed. A SUD is a substance abuse treatment facility. An evaluation must be completed by a substance abuse provider before a child can go into a SED. A child may also only enter if they are in full agreement of participation. In order to get into any of these levels of care, Medicaid funding must be requested. The Medicaid funding will be requested through placements. They will take our staffing and the notes along with the recommendations and use it in their determination for higher level of care funding. In order to get into a SIP or a STGH placement, children must have what's called a suitability assessment. QEs are completed by a qualified evaluator or a therapist who is trained in completing the assessments. Children must be discussed in an HLOC staffing prior to the referral being sent into the QEN network. In order for a child to qualify for an assessment, they must have had several Baker Acts with severe mental health issues not improving at lower levels of care. Referral is completed by the case manager and sent in with supporting documentation. Someone from the clinical department will review the referral for its entirety and then send it along if it meets standards. If there are concerns, the reviewer will send it back to the case manager for corrections. Once children are recommended for a high level of care and placed, they will require updated referrals every 60 or 90 days, depending where they are on their timeline. Newly placed children have an initial evaluation at the 60-day mark, where children staying in for longer periods of time will have them every 90 days thereafter. So what exactly is the process? The FCC will send the suitability assessment referral to the clinical team at partnership. The clinical team will review the referral for completion of documentation. Once approved, the clinical team will authorize and send the referral to the QEN network. The QEN then sets up an appointment for the child to be seen by the assessor, which typically happens within the first couple of days. The clinical department will notify the team of the appointment. The point of contact indicated on the referral must be present with the child via telehealth. It's the FCC's responsibility for transportation of the child if needed. The qualified evaluator will reach out to the required parties in the case to obtain information on the child. Once the evaluation takes place, the assessor will document their assessment and send it back to the QEN within 3 business days. The QE then will send it back to the clinical team and we will disperse it amongst the parties. Reconsideration is recommended. The clinical team will work closely with the case manager in filling out the reconsideration documentation. Once that is completed, the QEN has the ultimate decision to either accept the reconsideration request or deny it. Either way, they will let us know their decision in writing. Clinical staffings. In lieu of an HLOC staffing, the clinical team is set up to staff cases that just need a little bit more oversight, maybe some ideas or another opinion on how we can help children in need. Case managers can reach out to the BHC or anyone on the clinical team and ask for clinical staffing set up. The clinical team will ask some clarifying questions and get some additional information, and then we'll set the staffing for you. Now let's talk about our funding sources. Everybody that is sheltered by the Department of Children and Families and under the care of PSF will have active Medicaid. Rev Max controls the Medicaid referrals and is a great point of contact for any concerns regarding Medicaid. Most children are under the CWSP plan, which is the Child Welfare Specialty Plan, ran by Sunshine. There are some other Medicaid plans in the state of Florida, such as CMS, Humana, Staywell, United, and Molina. However, sunshine is going to be our primary plan. Quality of care issues and concerns. Unfortunately, there are times when working with families, you will find a concern regarding the quality of care our children are receiving. Specifically, this means issues or services compromise patient safety and have an adverse effect on the enrollee. As a staff member of a CBC who interacts with foster care children, caregivers, and providers, you may become aware of a quality of concern or service issue. Examples may include unfair treatment by a caregiver or a provider who may not be providing services as outlined by the child treatment plan, such as an STFC Level 2 therapist, conducting weekly visits instead of the twice weekly visits. If the concern is medical in nature, please contact your nurse care coordinator as well as your supervisor within 1 business day of becoming aware of the issue or concern. The nurse care coordinator is Cheryl Dawson. If the concerns are behavioral health in nature, please contact myself, the BHC, located in the Gainesville office. Fraud and abuse. You are responsible as an employee or a person who's working with enrollees on the Medicaid program to report any signs of fraud and abuse. When you are conducting home visits or interacting with treatment providers, it is important that you ensure that billing and data information is accurate. Be on the lookout for any suspicious activity and verify any information that's provided to you. Remember, fraud requires that a person has an intent to obtain payment and the knowledge that their actions are wrong. Waste and abuse may involve obtaining an improper payment, but does not require the same intent and knowledge. So how do you report fraud and abuse? There is a Medicaid number that you can reach out to. There's a Florida Attorney General phone number, and then the Florida Medicaid Program Integrity Office. You can also reach out to the clinical supervisor or anybody on the clinical team, and we can help you take it from there. This is my contact information. Leah Grace is the staffing coordinator, and her information is here. If you have any questions or comments, please don't hesitate to reach out. Thank you.